Hi, this is Dr. Doerr with Bergen Chiropractic and Sports Rehabilitation Center. As always, Dr. Doyle is with me. And today we have Chris Dellafave, who is a world record holder in powerlifting. I'm going to actually let him say what his world records are because they're large and the numbers don't make sense to me.
So I have a couple. The majority are in the 242 weight class. I have the world record squat at 1160. I have the American deadlift record at 900, and then I have the single ply total record at 2550, the multiply total record at 2735, and the unlimited total record at 2870, as well as the all-time world record deadlift at 275 of 910s.
So the important thing to understand out of all of that is if your car ever gets a flat and you don't have a jack, he can actually be the jack for you. So we're lucky today because we're going to continue on with some of the lifting topics that we've done in the past, except get a perspective of somebody who actually competes on this, not necessarily as a trainer, although he does coach, and we'll get to that in a few minutes, but as somebody who actually is competing at this kind of a elite level. So first of all, let's just take one of the questions that I think we've been hitting along the lines as we're doing these podcasts is, Chris, how old are you now?
36 and a half.
And how long have you been doing this for?
Lifting weights or competing?
Competing.
Since 2007.
All right, so quite some time.
Almost 20 years.
Yeah.
Almost 20 years.
All right. At the elite status that you're doing, at the ridiculous amount of weight that you're actually pulling, pushing, squatting, what is it, how do you keep yourself in this kind of a form that you can actually keep doing this as long as you have?
So I think a lot of it is programming, knowing when to push and knowing when to tailor back a little bit. Obviously, if you're going 100%, every week, every day, things are going to break down, things are going to pop. Mm-hmm. So I think programming is definitely the biggest factor. But I think as I've gotten older, my recovery has definitely played a huge role in allowing me to, continue at a high level. Because, there's always people that are, come and go in the sport, they'll put up big numbers and then you don't hear about them 5 years later. Mm. So I've been lucky, although, with all the injuries, which you're aware of, still being able to come back and continue to compete at a higher level, I think, is because of better recovery and better programming.
Now, it's interesting, just because you brought up the recovery, I want to bring up one of the injuries that you and I kind of worked with together. I know the more recent one, you're working with Dr. Doyle a whole lot more than me. But if I could bring you back to this one, and maybe you remember what it was, where we had that injury.
Which one?
But you were basically going to compete, but at the same time could not train. So it was like recovery. Oh, yeah. Do you remember what I'm talking about?
Yeah.
And you actually, again, it wasn't the best overall, but you still had great lifts,
right,
despite the fact that you really didn't have the training that you normally would do. Talk to me in that evolution in your brain about going like, wow, maybe I need more recovery. Maybe, where did your brain go after that kind of an injury and then realizing like, holy cow, I don't have to go quite that hard all the time and still get my lifts in?
So, if you rewind 10 years ago, the thought was if I'm not training heavy all the time, I'm getting weaker. Mm-hmm. Or if I'm not squatting at least 1,000 pounds every week, then my squat's going down or whatever. But I think if I'm thinking about the same injury that you're thinking about, that really flipped my perspective and kind of made me second guess that and kind of think maybe if I do tailor back and I limit intensity and volume appropriately, then I don't need to train as heavy all the time, because let's face it, there's only so many big lifts that your body's going to be able to handle before something pops or it just starts, numbers start tailoring the other way. So I think, again, now as being in the sport for this long and doing it at a high level, being able to show up week after week and still lift, but being able to do it, what's the right word? program efficient I think is more important than just like trying to bash your head into a wall every week.
Yeah, which I do on a daily basis. Now you do have an extreme sport. Like there is very few sports that run at the intensity that you do. And from that same standpoint, that also means what you put into a single part of your workout, then even within your workout, there's recovery time.
Oh, yeah.
So, look, I look at soccer. Soccer's my sport. Volleyball was my sport. Track and field was my sport. Your recovery was like walk to the next blocks. But that's what we were trained to do. It's like you need to be able to reproduce. Soccer is the greatest sport from the standpoint of 10 to 30 meter lacrosse as another great example of 10 to 30 meter sprints. And then walk for a minute and be able to do it again and be able to do it for 1 to 3 hours depending on what you're doing that day. Talk about what's the recovery within your workouts.
So again, has changed from even 5 years ago to now. 10 years ago is a huge difference. But after a real heavy, whatever lift we want to call it, squat, bench, deadlift, if we're taking a big hit, I call that like a big lift. If we're taking a big hit in the workout as a max effort movement, all of our accessory movements after that are all recovery based. We're trying to get blood in the area that we're worked. We're trying to make sure that any little nicks and dings are feeling as better as possible, or you're never really feeling 100%. But so for an example, if I am taking a heavy squat and I'm going into the 11s or the 12s, right, I'm not then going to do accessory work that's taxing, or not taxing, that is as taxing on the body. So I'm not going to take another lighter squat. Whereas my accessory work may be like body weight lunges or goblet squats, reverse hypers, a lot of reverse hypers, Copenhagen's, things like that, where like those smaller muscles that are getting worked during the main lift, I'm going to get blood in there for recovery purposes as my accessory movements later in the workout. Okay.
Now, there's something that I have to bring up. It's an interesting thing. I just found this out, by the way, last Saturday.
Okay.
And this was coaching my soccer team.
Okay.
10 to 14-year-olds. So I'm giving you the age group. We had a young lady who played with us 2 years ago. So she stopped playing when she was in the 8 to 10 group. She never went on to the next group. She came back into our fold. She's really not on our team, but we brought her back in to play. And the reason she stopped playing was because she started feeling less confident. She's a bigger girl, a little bit more tree trunkish than
your normal long
style for that type of sport. Mm-hmm. She kicks like a mule now. Without an exaggeration, this girl can kick a ball from our goal mouth to midfield, and she is no taller than this.
Oh, okay. So
found out she started powerlifting. So I actually want you to take powerlifting, because what do most people say about if you're a lifter? Well, you lift to be good at lifting.
At lifting, right.
Except, no, she's powerlifting, first of all, as a 10 to 14-year-old, which I also want you to talk about. 100%. How is it that you can actually use the powerlifting to translate it into different sports and actually make you better at that sport?
When you say powerlifting, we're saying squat, bench, deadlift.
Yep.
The power lifts,
yep.
Right? Any sport is going to require athletes to be strong, right? That when I'm not saying that they need to squat 1,000 pounds, but they need to be strong for their body, to be able to move, to be able to cut, to be able to whatever sport you're talking about. And if you don't have, or if you're not capable of controlling your body because you're not strong enough to do that, you're going to see issues in your play. So I used to coach football, wrestling, whatever. Strength training was always a huge factor in our athletes' progression, whether it was in season or out of season. There has to be a continuous goal of at least maintaining strength or getting stronger for any athlete if they want to see progression in their play. Right? And now obviously there are outliers, but your normal 95% of athletes can benefit from being stronger.
Now, from that same standpoint, going back to this young girl, most people would think powerlifting, older, maybe late teenagers, 20s, 30s. what do you feel about a younger person getting involved? And obviously there's significant limitations that you'd have to put on them that you wouldn't put on your adult. Talk about that. Like, how would you manage it? You got a 10-year-old, a 12-year-old that shows up in your gym, and you got to train them to be a powerlifter for their age. What are the differences?
I think first and foremost, technique is always going to be the most important. It should be the most important for any lifter, but for a younger lifter especially, like, their technique should be very sound. You should be able to look at that and say, I want all my lifters to be able to squat like that, for an example, because it was taught correctly and they're implementing it correctly. Outside of that, I mean, as long as technique is sound, you can slap weight on anyone, whether it's a 10-year-old girl or a 40-year-old, adult male. As long as technique is the primary focus, because it's always going to be easier to get someone strong when their technique is sound, right? There are, again, outliers, but majority of people are going to find their ceiling, their strength ceiling, earlier if their technique isn't ideal.
Not to mention breakdown.
Yeah. I mean, that's when you're going to see injuries. You're going to see worse technical breakdowns because they're not able to control their body underweight. And that's really the problem. They're not strong enough to control their body movements with weight on their back.
Now, I also found it interesting, and this is where I'm going to bring in Dr. Doyle with you, because the two of you at least have a similar age category. I'm a little bit more advanced in ages. Dr. Doyle lets me on a daily basis about that. But when I was in school, and again, soccer, track and field were really my big sports in high school. Like, we didn't get into the weight room. And in fact, they almost didn't let us in the weight room. Now, I never got past the high school level from a standpoint of organized. Like, I went to Rutgers University. I was a good athlete. I was not a Division I, especially soccer. They were national runner-up to the national championship that year. Good. Alexei Lelos played my position. Wasn't making that team. So I never really got to play in college. I got to play again competitively after college. Dr. Doyle got to play in college. I'm curious as to how you've seen that transition from somebody like me who graduated high school at 1990. I was in high school in the 80s, where a lot of the sprinting, running sports, even as ballistic as I was a hurdler, I was a jumper. You'd think lifting would have been important. I was a soccer player. You think lifting would have been important, especially I was a center back. Dr. Doyle, you've actually gone through collegiate lacrosse. Describe how you've seen lifting, if it actually was a large part of your programs. How did that become part of your training program within college athletics that I might not have seen at my age category?
Yeah, I think that when I was lifting in high school, every high schooler is just like, why are we doing this? Especially certain sports, you don't see the value in it. I really saw the value in it when I took what I learned from the weight room in high school and brought it to college, because we lifted in college as well. And I realized at my position, which was I took the center draw. So I start the game and you're basically trying to win the ball from the other player. And the person who wins the ball is the one that's stronger and faster. So it has nothing to do with height. It has nothing to do with how high you can jump. It's always stronger and faster. So the weight room is really what got me to that level. And now I can look back and see that. I think there's a lot of faults in the weight room, especially if you're putting high school players in there. If you're not having a solid coach to teach you, they always say, progressive overload and, go to failure. And I don't think they teach what failure is. I think they think that failure is right when you can't lift another rep, but failure is when your form starts to degrade and break down. So it's a big thing learning what failure is and learning to go to that limit and not pushing it to the point where you're going to compromise your back or your core.
And from that same perspective, now again, soccer wasn't your sport, especially in high school. I mean, I know what you did in high school. But what would you say? Because, I mean, obviously I'm seeing young soccer players powerlifting and getting better. I mean, quite frankly, dominant on the field. And they are not the best athletes. They're not even close to the best athletes. But all of a sudden, a guy twice her size can't run through her. She outkicks that same person if it's a 50-50 ball. So the lifting, the strength training is very transferable to almost anything, even a sport that they would consider more finesse, less contact, but talk about like, where are you bringing this in? Because quite frankly, I see this as an area that probably is unexplored. In all honesty, most of them, as Dr. Doyle is saying, it's like a coach is sitting in there who probably doesn't even understand technique. Whereas somebody like yourself, who's a master of technique, you couldn't do what you did unless you were amazing at technique. You would fall apart and crumble. How do you see that integration in what you do and bring that into younger athletics all the way through?
So even though a little bit younger, there was still, when I was in high school, there wasn't a huge push to work out. Like even playing football and throwing trap and throwing shot and disc, like it was always practice, do what you needed to do on the field, and then if there was any time, go work out. Or the lineman should be working out more than the running back. So the line is going to go lift today, and the running backs are going to go run more. Or I had friends that played baseball, basketball, golf even, and they never saw the weight room. And this was only in 2000, and I graduated in 2006. So 2002 to 2006 was when I was in high school, and there wasn't a strong push to lift. Now it's totally different. Like you said, you have 10-year-old girls competing. And I think it's twofold. One, there's more education, right? Because of the internet, right? So there's a lot more out there that people can read and understand and see the benefits of lifting weights, and see the correlation to increased athletic performance with higher strength ranges. But I also think that people are just in general are being introduced to it more, just lifting weights in general.
Absolutely, yeah.
So you have a wider range of people, I guess, interested in it. So they are trying to learn more. They're trying to understand more about it. And I think because there's so much more information, you do have more people who are versed in it where they can coach. Whereas, like you said, 20 years ago, there was the assistant football coach sitting in the weight room who probably was a history teacher who maybe never lifted weights before outside of playing football, is the one sitting in the weight room. Whereas now you have some schools that are actually hiring professional strength coaches to come in and write up programs for their teams, break down or teach form, correct form, doing all those things, because I think there is such a stronger push across the board for lifting and strength training in terms of athletics.
Would you say there's any age category? Actually, let's go to the opposite side of it. I mean, my personal feeling is now that obviously a lot of people are just trying to get not even just increased muscle mass, obviously increased strength, but also understanding the importance of that muscle mass as we age.
Right.
But let's save that topic for just a little bit later. But when is it that you go like, yeah, this is not where you should be right now? Like, how do you actually tell people that? Because a lot of people are going into the gym and just doing whatever. They're going crazy.
Right.
When is it that you actually can look at somebody and say, you got to back off here? Like, what you're doing is going to cripple you. What is it that, I mean, I know we've already talked about technique, but are there any other red flags that you as an expert, like lifter, or somebody who actually knows technique like the back of your hand? I'm thankful that I've seen so many videos from you that I'm starting to get to a point where I can see a waggle in a millisecond.
Right.
But where is it that you look at things and say, like, you need to back off, you need to actually go get away from here, but get to this first?
Dr. Doyle mentioned it, overload progression, right? If you see someone in the gym, they can't do a, squat 135 with a bar on their back without, just a free squat, then obviously they shouldn't put any more weight on the bar. Mm-hmm. I don't necessarily think there's ever going to be a conversation where it's you should do something different. I think the conversation is more, you need to take a step back and fix the issues that you currently have. So first thing that I always notice on someone who has poor technique is they don't understand their foot pressure, right? If you can't pressure to your feet the right way, you're never going to be able to properly open and sit back and, squat correctly. Mm-hmm. So if someone just looks like they don't even belong under a barbell, take the barbell off their back and have them squat. And if they can't do a body weight squat with no weight, then, going to go back to it, technically, they need to learn how to control their body just with no weight on themselves to then progress to be able to, put a bar on their back. Or if they can't squat correctly with the bar on their back, there's other variations that you can implement for someone, like a goblet squat, right? Where there's weight, they're holding something, but it's not on their back.
Yeah.
A single leg squat, not a pistol, but like a Bulgarian. If someone can't do a bodyweight Bulgarian, then there's a lot of pressure points, or there's a lot of technical flaws or there's a lot of technique involved in that movement. So if they can't do that, there's going to be a lot of overtly obvious technical flaws that you can see and then start to address. Again, like basic stuff would be foot pressure, would be not being able to externally rotate at the hip, not being able to hinge at the waist. Like those are three things that if you're not doing, or you didn't even know you should be doing, you're not going to squat the right way. And you could get strong not doing those things, but you're going to reach your strength ceiling way sooner than someone who can sit back and can open and can pressure correctly.
And start breaking down a lot faster.
And there's always going to be the higher percentage of injury if your body's not in the position that it should be when you're loading it.
Now, Chris brought up like literally taking the weight out of it and just looking then in motion, that's something that's technically we do all the time. When going back to that squat, since we're on that topic now, what is it that you're seeing within just a bodyweight squat that is giving you hey, we need to definitely get this done or this done or this done before we even get into a training program?
So the biggest thing I see, especially in a body weight squat, most people do not do dedicated core exercises. So they completely hinge forward when they're doing the squat, which means even if you put weight on their back, it's going to just throw them completely forward. It's going to put stress on their knees. So doing more core generated exercises, definitely. I see a lot of bending at the knees, whether they're wobbling forward, a little valgus stress, or more externally rotated feet, as Chris was saying. And that's just working on tibial rotation, glute control. But again, I think the biggest fault has been core.
Yeah, and I know from my perspective, Dr. Doyle already hit on the core, but the other thing I'm always looking for is the ankle. What is the ankle doing? Like, because quite frankly, if they can't even find the dorsiflexion to get into a squat, all it's going to be is rotational control issues, and that's eventually going to wear knee, hip, labral. Knee. It's going to all eventually start crumbling apart as well. Mm-hmm. So all of those things, I think, do come into play, and I think that is actually probably where most of us should be starting with, especially our younger athletes.
100%.
Or the athletes that, it's always funny when you watch people lifting in the gym who apparently have been lifting forever. Incorrectly forever. Somebody who does a row completely with their arms and never has engaged their shoulder blades once. People doing like massive weighted hyperextensions. And eventually I'm looking at them going like, the disc shear you're putting on your body is enormous. And at some point it's going to pop on you. Hopefully I'm around when it does. But those are all things that I think, being able to look at them in motion, looking them in body weight, and then being able to determine where it is that they should actually start. I think all three of us have pretty much kind of hit on that pretty regularly. I think we have another couple of topics that I'd like to discuss, everything from the standpoint of health associated with an aggressive sport like yours, recovery from it, how do we prevent it as best as possible.
I wish I knew.
And then also, we've talked about the youth. I want to talk about how long can we do it for. All right, so I'd like to take that in our second half of our podcast and look at those topics and how it is that we can actually manage the health as well as the longevity as we go through.
I think that is something that is overlooked because everyone wants results right now.
Yeah.
And even if someone shows higher, levels of promise, where their first meet is, very good, or they've hit some, big numbers early on, it's not sustainable to assume or to think you're going to get those results time over time over time again. So to think that, okay, I just squatted 1,000 pounds this meet, I'm going to squat 1,100 pounds in 6 months.
You know, that's another one that we'll ask in a second. So stay tuned. I think we've teased the second half of our podcast pretty well. Again, Dr. Greg Doerr from Bergen Chiropractic, Dr. Doyle, Chris Dellafave. We'll see you in the second half of our podcast.